Authorities on both sides of the Atlantic are scrambling to slow a highly contagious variant of the coronavirus. In the U.S., top health official Anthony Fauci is urging people to get booster shots, wear masks, and reconsider travel plans as the Omicron variant spreads. That's as other European governments clamp down on public life to battle the new strain. The Netherlands has become the first to impose a strict lockdown over Christmas.
For many across the Netherlands, it's the variant that killed Christmas. Thanks to the highly contagious Omicron, the government has ordered all non-essential businesses to shut till mid-January. Christmas gatherings have also been curtailed. People will only be allowed 4 guests around the tree on the holidays. For some, the new measures were a surprise. We thought we had it under control, that we'd done everything we could. We're fully vaccinated. You do everything you can to support society a bit, but in the end it all goes wrong anyway. Denmark too has brought in new restrictions amid surging COVID infections. The variant already counts for 1/5 of new cases there. Germany has also taken steps to slow Omicron's race across the continent, severely restricting travel from the UK, where the variant is rapidly becoming dominant. The country's health minister has said new restrictions can't be ruled out before Christmas. Beyond Europe, Omicron also poses a threat.
Omicron is increasing rapidly, and we expect it to become the dominant strain in the United States, as it has in other countries in the coming weeks.
In New York, the epicenter of the US's first COVID wave, the variant is already thought to be behind a record increase in cases. Authorities are urging people to get vaccinated and boosted to avoid a repeat of 2020. But with Omicron already present in around 90 countries and spreading fast, the world looks set to start yet another year locked in battle with the coronavirus.
Let's bring in Peter Chin Hong here. He's a professor of medicine at the University of San Francisco of California in San Francisco. Good to see you, Dr. Chin Hong. We're seeing rapidly rising Omicron infections here in Europe. Is the rest of the world on a similar path?
The rest of the world, Terry, is definitely on a similar path, if not worse. We have to fasten our seatbelts for what will be a tremendous ride. If you think about 3 things that will affect transmission in a population, previous immunity, we know that Omicron is 5 times more likely to cause reinfection than other variants. Vaccines have not had high uptake in many countries around the world, as low as 6%, which may not protect. And don't even think about boosters. And the third is risk mitigation. A lot of pandemic fatigue, a lot of masks not wear. So I think we're in for a ride.
Well, here in Europe, at least, and in the U.S. as well, most governments are pushing people to get their 3rd vaccination. But will a booster be enough to get on top of this here?
It wouldn't be enough, Terry. You'd still need the extra risk mitigation factors like wearing masks, doing diagnostic tests, but it does give us the best armor. If you think about some of the initial studies, 20% protection against infection if you're presented with Omicron. If you get a booster, you can go up to 55 to 80%. But again, not 100%, so you need the other stuff. But we do believe that even with 2 doses, you will be protected against serious disease, hospitalization, and death, perhaps unless you're older than 65 or immune compromised.
Now, you mentioned the risk of reinfection earlier with Omicron. Do we have enough data yet to know how dangerous Omicron is compared to the Delta variant?
Well, I think a study from the University of Hong Kong is instructive in this regard. They found that Omicron produces 70 times more virus in the airways. But when you look in the lungs, there isn't a lot of virus there, suggesting that it's very transmissible without causing a lot of inflammation in the organs. We do know that in South Africa, in Delta, you get about 20% hospitalization. With Omicron, 2%. A study in the UK showed no difference. But even if you do think that it's causing fewer hospitalizations, when you have a turbocharged transmissible virus, even a smaller percentage of a large amount of people could potentially strain hospitals.
What advice would you give people going into Christmas week?
Well, I think about the ABCDEs. A is to assess the destination you're going to, high amount of virus, and assess yourself. If you're immune compromised, unvaccinated, or older than 65, you may worry. B, definitely get your booster from what we discussed. C, vaccinate your children if they're eligible. D, do diagnostic tests like rapid testing before going in any gathering, like a family reunion. And E, everything else. Wear a well-fitted mask and get your flu shot.
Dr. Peter Chin Hong, thanks for talking with us. That was Professor Peter Chin Hong at University of California, San Francisco.
My pleasure, Terry. Thank you.
And for more on this story, I'm now joined by Dr. Wolfgang Preiser, a virologist from the University of Stellenbosch. Thanks so much for coming on the show. Now, you're part of a consortium that first detected the Omicron variant. All eyes are on this new variant as it spreads around the world. And as we've seen, Europe is struggling to curb infections. Can you tell us what the situation is like in South Africa?
It may sound as a bit of a surprise because I see from afar that how Europe is really trying hard to control the spread of Omicron, which is happening so fast. We are relatively relaxed, and the reason is that also our infection numbers shot up from very low levels. In contrast to most of Europe, we had very low levels before Omicron came about 4 weeks ago. And since our numbers of infections are going up, fortunately, our hospital admissions are not keeping pace. So they are lagging behind. And we are actually in a more comfortable situation than we were when we last saw this high numbers of infections in our previous waves. And we think that is due to the fact that many South Africans became infected during the previous waves. Of course, many people also died. This is, that is the sad truth. We lost many people who belong to the high-risk groups. But those who survived, plus about a third of adults who have now been vaccinated, they probably have some degree of protection against the severe course of Omicron infection. And that is what is so far protecting our healthcare system.
So is it fair to say that those people do indeed have some kind of protection against Omicron? Is the variant different enough that people who have already been infected and have recovered can be reinfected again? And is that in any way affecting total population immunity?
Absolutely, it is. That is the worrying aspect of this new variant. It is very capable of infecting people who have some degree of immunity. And in fact, a recent study of ours has shown that German visitors who even had their BioNTech Pfizer booster doses still became infected with Omicron. So this virus is very capable of undermining a pre-existing immune response. But we still, we think what we are seeing is that previous immunity gives still protection against severe disease. And this is why it is absolutely correct when people say that even though the current vaccines do not give perfect protection against Omicron, much less so than against the previous variants, it is still the right thing to do to become vaccinated, and if necessary to also have a booster dose, because that strengthens your immune system and that allows you, should you become infected, to not to go on to have severe disease. So that is what we think we are seeing currently in South Africa, and this is where Europe also needs to get to in order to weather this new Omicron storm that's ahead.
And yet this winter is, for many, going to be a bad case of déjà vu. What needs to be done so that we don't continue to see the development of variants like Omicron disrupt life at this scale?
So firstly, I think for Europe, and winter is, of course, a tough time. I think a degree of lockdowns and intensified measures is unavoidable, and that's being introduced in many countries already. But secondly, the big way out of this without risking even further loss of life and health, and let's not forget even people who survive and spend weeks in intensive care or have gone on to develop long COVID, they have a very rough ride. It's not a harmless infection at all. So the way out of this is universal vaccination. So we all need to get into the new age where we all will become infected with SARS-CoV-2, the positive virus, probably many times in our lives. But when we enter that phase, which is the endemic phase, we need to have good baseline immunity. And the best way to get that without risking, severe disease is, of course, vaccination. And in future, I hope also we will have updated vaccines that include and give better protection against Omicron, which will make that better. But at the time, for the time being, really, I fully agree to the pleas to please become vaccinated if you haven't done so, and get your booster doses as the best way to counter Omicron, but still be ready to become infected, because this virus is very capable of evading the immune response.
Okay, clear call to get vaccinated there from Dr. Wolfgang Preiser, virologist from South Africa's University of Stellenbosch. Thanks so much for coming on DW News.
Pleasure.